Hello and welcome to YouTube channel Health Cube, the place where my mission is to motivate you to look at the bright side of the health. I am your host physiotherapist Meghana, and in today's video I'm going to talk to you about some of the relaxation techniques that you as a parent can use at home in order to help your child suffering from cerebral palsy. So, interested in learning about this topic? Make sure to watch this video till the end. Let's begin. Friends, most of the parents whose kids are suffering from cerebral palsy are always concerned about what they do from their end to help their child overcome the difficulties and impairment that he or she experiences in their day-to-day life. Spasticity is one such impairment. I believe spasticity is one of the most difficult thing to deal with when it comes to managing cerebral palsy. Spasticity is nothing but an excessive tension that's present in the muscle. This hypertonicity does not allow the movements to happen freely. It leads to contracture and also sometimes pain in the limbs. This particular impairment not only is a troublesome thing for the child, but is also a big roadblock for therapists to achieve maximum recovery as possible. I always believe that 75% of the therapy of child can be done at home, and parents are the better therapists for their kids compared to therapists themselves. So, why to rely a lot on muscle relaxant Botox? So why not to add certain things apart from muscle relaxant medication or else Botox to help your child achieve a better level of muscle relaxation or else to reduce the level of spasticity. Even many research papers have shown that when relaxation practice is done on a regular basis along with the medication to achieve or else reduce muscle tone and spasticity is better and is helpful for kids to overcome spasticity related impairments. What are these methods? Let's have a look. So the first method to achieve muscle relaxation is therapeutic massage. Yes, massage has got many benefits, especially when it comes to achieving the goal of muscle relaxation. Massage technique not only improves the blood circulation in the muscle area but also helps in subsidizing or else relaxing the overactive nerve endings that are present. Relaxation technique, especially through massage, also helps in maintaining a good amount of blood flow in the muscle and thus achieving reduction in the level of muscle tone. Massage can be done starting from a newborn baby to a child who is from around 5 to 7 years old. Even though there are a lot of controversy and many doctors tell you that massage is not advisable for CP child, and the reason behind this is the wrong technique. Most of the time, the traditional way or else people who are not aware or else are not educated in the space of massage tend to do wrong massage techniques over the kids, which impacts or else hampers the situation of the child more than doing benefit. And that's why massage is usually said as no-no by the doctors or as therapists. But if massage is done in a scientific and right way, helps to achieve tremendous amount of relaxation. Massage technique should comprise of methods like effleurage, massage, stroking, as well as myofascial release. Myofascial technique is a technique which especially is helpful to get rid of all the trigger points and tight bands and knots that are formed in the muscle. It reduces the adhesions that are formed in the fascia and thus improves the mobility of the muscle and allows the movement to happen freely. Apart from massage, music therapy or else relaxation technique with the help of meditation is also a tremendously helpful way for a child who is suffering from cerebral palsy. If a child or as a kid is too small and do not understand the process of meditation, even an exposure to gentle music therapy every single day helps in reducing the level of overactive neurons and thus helps in reducing the level of spasticity. Music therapy or else calming music have a very good result when it comes to a child who is suffering from spasticity. Coming to the third method, and that is gentle passive range of motion exercises. Now, definitely this is not something new, every one of us practice. But again, when gentle passive range of motion is done in right way, is the only method with which you can not only achieve the benefits of muscle relaxation, but also helps in preventing muscle tightness, joint stiffness, and prevention of contracture. Hence, every parent should make sure that they do gentle passive range of motion exercises for their kid every single day. Gentle passive range of motion exercise are also beneficial as it can be done from all age groups, starting from a newborn baby to an adult who is say around 20 years, 25 years old. Gentle passive range of motion exercises are pain-free, are rhythmic, and thus also helps in improving the coordination of the child or as a person suffering from cerebral palsy. And the last method is progressive relaxation technique. This method was invented by Dr. Jacobson, and it's a very popular method and is not only used in cerebral palsy management but is also very helpful and is useful in anxiety disorders, stroke cases, muscular pain cases. So there are multiple uses of this method. Basically, in this progressive relaxation technique, the patient has taught to voluntarily first contract the muscle and then gradually relax those muscles. Even though this technique cannot be used for the kids who are smaller than 5 years of age because they cannot follow the methods of relaxation, but it's a very useful technique for adults or as teenagers who are suffering from cerebral palsy or as any kind of neurological disorder that involve muscle tightness or as hypertonicity of the muscle. So, today I spoke about these 4 methods. First, massage. Gentle therapeutic massage. Second method, music therapy or as meditation. Third, passive gentle range of motion exercise. And fourth, progressive muscle relaxation. Any of the method can be used by any of the parents at home, but make sure that you learn this technique very well with your therapist. If you learn this technique well, you can apply it well and you can see the benefits by yourself. Remember, if you are able to relax your child to a certain extent, you will significantly see a level of improvement in your child. This improvement will not be a direct reduction in the symptoms or as in the spasticity, but yes, this significant improvement would be in the level of spasticity or else in the level of overall well-being of the child. You cannot replace this with the entire treatment. But when this is added to the therapeutic regime, shows very good results. So feel free to reach out to me and I'll see you in another video.